All right. Thank you very much, Dr. Emeka. That was a very comprehensive presentation, no doubt. And it does bring us nicely, actually, back to our poll. How concerned are you about the relaxation of lockdown rules across Nigeria? So we had the most majority of the people, 75% of people who responded to it, said they're extremely concerned because they fear cases will increase. So we're just going to hear what our panelists think. Let's go straight back to Dr. Emeka. What do you think about that?
Yes, I think they have a reason to be concerned because lockdown measures, in theory, are meant to achieve two purposes. One, to limit the rate of the spread of an infection so as to buy time for the response entity to enhance their response. In the case of Nigeria, the idea of a lockdown would understandably be to buy time to improve testing capacity and also to buy time to improve the treatment capacity. We have currently about 4,800 active cases and 5,000 isolation bed capacity, meaning that clearly the healthcare system is overwhelmed, and an easing of the lockdown would result in a markedly and exponentially increases in the number of new cases. Yes, so to that extent, it's understandable to be concerned about easing the lockdown restrictions. With the benefit of hindsight, I think the government would have done a lot more in terms of increasing testing capacity, but also treatment capacity. As a country of 200 million persons, we should, at the minimum, have 100,000 bed space capacity. I think that will allow us the liberty to, at any point in time, ensure that there is a bed space for anyone who requires care. But it's good to know that the country is already considering home-based care as an option, considering the financial challenges of expanding the the bed capacity for institutional care. However, it's also important to know that there have been other consequences of this lockdown, some of which I highlighted. There are serious threats to human existence. Some people are facing threats to hunger, starvation. Some people are unable to access regular health care for other disease conditions. And there's a possibility that the mortality on account of inability to access health care on account of malnutrition and hunger might even outstrip the current mortality on account of COVID-19. So we actually need to achieve a balance here. I still think that it is a little bit premature to ease the lockdown, but at the same time, I do know and also advocate that we do not hold on to the lockdown measures for too long because of the consequences, the unintended consequences of the lockdown measures with respect to people's lives and other factors.
Okay, all right.
Yeah, thank you very much.
That's really helpful to know. Yeah, Dr. Berry, do you have anything to add to that?
Yes, I agree with Dr. Emeka on the issue of the lockdown. We have health and the economy at stake, and it's not about choosing one or the other. Really, it's about a balancing act. To just strike the balance given the Nigerian context. Yes, it's very concerning and relaxing the lockdown in some places is I believe is premature. Potentially, they could have extended the lockdown in the hotspots, Lagos State, Ogun State, and Kano State, while trying to increase the relief measures for the vulnerable population. But let's hope that it doesn't result into spikes of new cases, and so that we don't find ourselves in a situation where we are in a very, very difficult situation, because the rate at which Nigeria is moving, it looks like we might overtake South Africa if care is not taken. And so we have to be very, very careful in the way we implement the measures, and also relaxing of these movement restrictions. Thank you.
That's well, the likelihood that we might overtake South Africa, that's really concerning. Yeah, so let's really, as you said, hope that that's not going to happen. And obviously, we will do what we can to try and get some of what we're talking about, some of what's coming out of this, out to the Nigerian government and others that would hopefully have the ears of the Nigerian government. Okay, we have a question from one of our attendees, and the question is directed to Dr. Mary. So, Dr. Mary, you noted a significant number of people who contacted the virus recovered. What therapy combination of therapies helped in their recovery, recoveries, do you think?
So, okay, so let me just go back a little bit. For COVID-19 outbreak, we know that from statistics, about 80% of the cases will present with mild symptoms, 15% will present with severe disease, and 5% will present with critical illness. So now, we said earlier there is no specific treatment for COVID-19, and we know very well that this 15 plus 5, the 20% of people that will develop severe disease and critical illness are people that potentially might die, unfortunately, from the disease, but there are also high-risk groups, elderly, and people with comorbidities. In Africa, our population is younger. We also do not have so much of the comorbidities that you find in Europe, for instance, or in the United States or other parts of the world. I'm talking about the issue of high incidence of cardiovascular diseases, the respiratory diseases. We have hypertension and diabetes in some large proportions, but the other two are very limited on the continent. So these are some of the factors that has contributed to having a lot of people recovering rather than having so many dying on the continent. And from the statistics we are seeing, in countries where the testing strategy has been expanded, even up to 40 to 50% of cases are actually asymptomatic. So basically for those ones, they just need to self-isolate, take some rest, and wait for the virus to clear, because since we don't have specific treatment, and if an individual is not presenting with severe disease, it means that individual is not at the stage where you will require oxygen, for instance, ventilator or all that. So just minor treatment for fever and some of the symptoms is enough, and this individual can recover quickly from the virus.
Okay, thank you very much, Dr. Mary, for that. So we have another question for the panelists, one each. I'll go to Dr. Emeka first. You've talked about the situation with dense settlement, lack of, there are other factors like lack of running water. How realistic are common sense measures like washing hands regularly and social distancing? You've mentioned some of this already. Is there a way around this? Is there anything else that can be done instead of, if they're not realistic enough? Is there anything else that can be done?
Yes, sure. Thank you very much. There's certainly something that everyone can do, right? Regardless of your living circumstances. And that is to wear a face mask, to wear a cloth mask. Pretty much anyone can make one at home. and use it. You don't even have to literally make one. You can use a handkerchief or a used cloth and just put it around your nose if you have to go out. So it's a very, very effective measure of control. We recognize that to get the benefit of it, it has to be done in combination with washing of hands and physical distancing. So there's really no magic bullets as far as the prevention of COVID-19 is concerned. It requires having a combination of measures. And anytime the science proves that a new measure has been effective, of course, the population is made aware of that measure and they can follow it. So I would strongly encourage everyone to put on a face mask if you have to be out in public, realizing that being physically distant from someone is not entirely up to an individual. Once you are in public, you may try to abide by physical distancing, but if people around you are not doing same, sometimes there's little you can do about it. But there's something you have control over, which is the use of your face mask. Then secondly, we do know that the use of an alcohol-based hand sanitizer, especially one that has the required level of alcohol in it, is also a substitute for hand washing in circumstances where it is not possible to wash hands with soap and water. I know this comes as a cost, but I also do know that there's been efforts to make hand sanitizers available at public places, shopping malls, and all of that, and people can, take advantage of this provision to have that extra layer of protection in keeping themselves safe. Over.
All right. Thank you very much for that. Leila Gogora also has a question. It says, how does incidence and death rate of COVID-19 compare with other common diseases in Nigeria, such as malaria? We know that malaria has been around for a very long time in Nigeria. How does the incidence and death rates compare? Let's go first to Dr. Mary, please. Although you probably won't have
it's okay. It's okay.
Nigeria specific data, but maybe you can just.
It's okay. Yes, so at least I know the context. Yes, Nigeria is endemic for malaria, but the two diseases are not the same. Malaria, we have a known treatment that is very, very effective. We can test easily, and so it's easy, even though we have a high burden, it's easy really to respond to it. And we know that potentially adults do not really come down with severe malaria. The high risk group is the under 5, and with the effective treatment, it's possible to take care of malaria and prevent unnecessary deaths from malaria. But now for COVID, this is a new disease. There is no vaccine, there is no treatment, and it is also highly, highly infectious. Highly infectious disease, you could potentially be exposed, maybe like Dr. Emeka was saying, unintentionally. So sometimes, yes, we can do social distancing and some of the measures, but we also know the context in which our country is, especially for the vulnerable population. You saw the way the outbreak was growing in Kano. It was just jumping. The numbers were jumping. It's simply because of the kind of living conditions you find in Kano State. So the diseases are not the same, and I don't think I would like to compare both, because really it's not. COVID is much more serious than malaria, and I think we can avoid it, because if you look at the outbreak globally, you can see that our lives has changed completely. So bringing down the economy, changing the way we do things, and stopping basically our lives. Malaria doesn't do that. So the gravity is not the same. And to add to the question that Dr. Emeka responded earlier on the hand washing and social distancing in difficult contexts, both in Nigeria and elsewhere in Africa, There are other things we also do in addition to what he said. Responding to other outbreaks like cholera, you can do water trucking. Let's say a community is having cholera and their source of water is contaminated. Really, water trucking can be done. Distribution of soap, it's done. UNICEF does that a lot, and even the hand sanitizer.
Could you explain what water trucking is for those of us who are...
So water trucking is supplying water to that community from an alternative source using tankers. So you bring the tankers and then they come and get the water from the tankers.
Okay.
Right. So yes. So while you treat their source of water, so you have to provide an alternative source for them. And then for those communities that are also not able to social distance, if there is a household in which there is an infection, you can also quarantine that household to prevent exposure to another neighboring household. So basically, these are not very new things in Africa. We've been doing this for Ebola, for instance, the issue of the hand washing. We possibly we are calling them different names, but there are things that we've been doing before, and I believe that we can still use those to respond to the COVID despite the challenging context we have.
All right, thank you very much. Dr. Emeka, do you have anything to add to that comparison? You are in Nigeria, obviously. Have you heard any direct comparison in terms of numbers?
Again, it is too early to begin to make that comparison. When you look at when you speak about things like mortality rates, typically you would want to look at it over a given period. And for most disease conditions, the standard period over which you can look at a mortality rate is at least 1 year, right? Okay. And so COVID-19 in Nigeria, it's barely 3 months, maybe 4. And it's evolving by the day. It's yet to get to its peak. On the other hand, malaria is endemic, so we can almost predict what the mortality rate in each year would look like. So it is too premature to begin to make any form of comparison. But some things we do know, like my colleague mentioned, malaria, we know enough about it to know how to prevent and to treat it. COVID-19, we're still learning. There's still as yet no known cure, no vaccine. So perhaps 1 year down the line, we can look back, then we'll be armed with the information we need to even attempt to begin to make a comparison to know if the measures we are taking at the moment are either exaggerated or they were very appropriate. Time indeed will tell. But just to say that the mortality rate, especially in the western part of in the Western world, is quite concerning, and there's really no reason why Africa, could potentially also experience something concerning of that nature. It's still early days, and so that's why we have to take responsibility, and we have to treat it with the urgency and with the seriousness that it deserves.
All right. Thank you very much for that. We have one more question from Rosalind Ezendokwele, and she's asked, what is the impact of the NCDC's leadership so far in Nigeria? And this is directed at Dr. Emeka. The impact of the leadership of the NCDC so far in Nigeria to bring the spread of the virus under control.
Yeah, thank you very much for that question. I must confess that given the environment under which things operate in Nigeria, I think NCDC has done a very good job so far. It's important to know that the best approach to a response of this nature is a multi-sectoral response, right? NCDC is a parastatal under the Ministry of Health. But beyond that, there are economic implications of the response. There are other implications of the response that are not necessarily health. I mean, Schools are shut at the moment. No learning is taking place except those who can manage with online learning, right? But to the extent that we're able to track the condition on a daily basis, there's no day that goes by without us being updated as a country. To the extent that guidelines are being developed virtually on a daily basis to adjust to the evolution of the disease condition, to the extent that the country has been able to support the response, across several states, gives room for commendation for NCDC. But I did point out that we have to recognize that beyond the NCDC, other sectors of government have their own share of responsibility. The state governors and their respective public health departments in the different states need to step up their game to complement the efforts of NCDC. NCDC is meant to be providing leadership, which they are doing at the moment, and rightfully so. But what we are seeing is that the other pieces of the puzzle are really not coming to the table, and that sometimes paints NCDC as having defects. I mean, they're getting all the support from donor agencies, WHO, the US government, and all of that. But I think what is missing here is the other entities at the state level and other levels also coming to the table and living up to their responsibilities as well.
All right, thank you very much. So we will end, but before we end, there's one more question that I just want to quickly ask, and this is very relevant to us as diasporans. And I want to ask both Dr. Mary and Emeka to close with that. Nigerian diaspora contributes a lot to the Nigerian economy. In 2018 alone, the Nigerian diaspora sent home an estimated $25 billion. But the Nigerian diaspora is largely untapped for conscious development in the country. COVID-19 provides an opportunity for that to begin to happen. What roles would you both suggest Nigerian diaspora could play during and after this current pandemic? Let's start with Dr. Mary.
Okay, thank you. Yes, we have a lot of untapped resources out there. The most brilliant brains we have are sitting in other countries. So for me, I will look at three things. First of all, our voice, the voice of Nigerians in diaspora. Even if you are very far away from Nigeria, you can speak out. You can speak out, provide your own thoughts about the way the response is ongoing, and potentially advise on how to adjust some of these issues that we are very much concerned about. I believe quite a lot of Nigerians in diaspora have people in Nigeria that they can listen to. So we can speak out at individual levels as a group. We can also support the country with our expertise. With this COVID-19, you don't have to be present in Nigeria to provide any kind of support. We know, like Dr. Emeka said, COVID-19 is multi-sectoral. So you don't have to be a nurse or a doctor to provide any kind of support. Economics can provide expertise to the government on how to cushion the effects, the socio-economic effects of the COVID-19. So we can provide our expertise in the different disciplines. Dr. Emeka talked about leveraging on technology for contact tracing. So Nigerians out there can also, I believe we have a lot of people out there that they can support and provide that technical expertise even remotely to the government and the response team. Then the issue of supplies. So if we are able to, he has talked about the number of ICU beds we have, the ventilators, even oxygen concentrators. I remember when I used to do clinical medicine, sometimes even in a whole hospital, there wouldn't be a functional oxygen, right? If you have a patient that requires that. So some of these supplies, PPE, laboratory testing is such a big issue. If we have access to this, we can also provide these supplies to the government. But overall, I believe that every Nigerian has a role to play and a contribution to make, whether you are living abroad or in Nigeria, for this COVID response. Thank you.
Thank you very much. Dr. Emeka, do you have anything to add to that?
Yes, I do. First things first, keep the diaspora remittances coming in. that shouldn't stop. That is needed now more than ever. I know that Nigerians in diaspora are not insulated from the economic effects of COVID-19 in the different countries where you are. I know that when we read on the news about job losses, it also includes Nigerians in diaspora as well. And I know that people will begin to reprioritize their needs for cash. And it's so easy to chunk off that list the remittances that come to the relatives in Nigeria. So the first appeal I would make here is that please keep those remittances coming, because that might make the difference between life and death, you know, for some weeks and some months and some years to come, as things are really, really very bad. And there's no recourse to government support whatsoever. We don't have social protection systems like you have in the diaspora. Also, for medical interventions specifically, like I did mention, there's been the health system in Nigeria is overstretched, and for some time to come, the majority of the focus will be on COVID-19, and other disease conditions are likely to be left unattended to. I know over the years there's been a lot of medical outreaches, right, which have been quite useful. So if this can continue, and a lot of these have been led by Nigerians in the diaspora. So if this can continue, that would help to close the gap that would likely arise as a result of the shift of focus to COVID-19. And then finally, because I do not want to repeat what my colleague has said, in terms of even experience sharing, just like we are doing on this platform, right? This has brought people from around the world and in Nigeria to share experience. So a lot of this will be required. This is one condition that has brought the whole of humanity together. This is the very first time in our living memory that there's one condition that is the headline news item in every single country around the world at the same time. It has never happened like this before. When it was the time of Ebola, it was just a section of the world that was dealing with that. MERS and SARS only were regionalized, but this is the first time. So we're all speaking the same language, and there's a lot we can learn from each other, and certainly a lot we can learn, you know, from Nigerians in the diaspora who are contributing to the response in the diaspora. So let's keep that communication channel open. Let's continue to have events like this. You know, the best form of support sometimes you provide is not even financial or material. Even experience sharing, you know, can do a lot more than material and financial support. So that should keep happening. And I would encourage DIND and other diaspora initiatives to sustain a channel of communication and experience sharing.
Thank you very much for that. Okay, so that really brings us nicely to the end of this event. Thank you very much to our speakers. Your wealth of knowledge and experience in this is vast, as I said before, and is well appreciated that you brought it to this event today. Thank you very much. We'll keep the conversation going. Help us to get the word out that we are trying to do what we can as Nigerians to, you know, make a difference in Nigeria, you know, to do our own part, and help try and get as many people as we can to join what we're trying to do. Again, thank you very much to our speakers. I know we can't really, give claps or anything like that. But Dr. Mary and Dr. Meka just assume that you're hearing thunderous ovation right now. I'm sure everyone that's attended has really appreciated it. Again, thank you so very much. And since people can see me, I'll just give you speakers a round of applause. Thank you very much. And thank you for everyone who attended.